Did you know that over 100 million people around the world get infected with dengue fever every year? It's now one of the fastest spreading mosquito-borne diseases, especially in tropical countries like Pakistan, India, Bangladesh, and parts of Africa and Latin America. But what exactly is dengue? And how can you protect yourself and your family? Let's break it down. Dengue fever is a viral infection caused by the dengue virus, or DENV. There are four types of dengue virus: DNV 1, 2, 3, and 4. Getting infected with one doesn't give you full protection from the others, which means people can get dengue more than once. It spreads through the bite of a female Aedes mosquito, especially Aedes aegypti. These mosquitoes have black bodies with white spots on their legs, and they bite during the day, especially in the early morning and late afternoon. After being bitten by an infected mosquito, symptoms usually appear within 4 to 10 days. Early symptoms of dengue fever include sudden high fever, often reaching up to 104 degrees Fahrenheit, 40 degrees Celsius, severe headaches, especially in the forehead, pain behind the eyes, muscle and joint pain, often very intense. That's why dengue is also called breakbone fever. Skin rash, usually a few days after the fever starts. Nausea and vomiting. Mild bleeding, like gum bleeding or easy bruising in some cases. Most people recover in about a week, but for some, it can become severe dengue, also known as dengue hemorrhagic fever, which causes severe abdominal pain, continuous vomiting, bleeding under the skin or from the nose and mouth, difficulty breathing, drop in blood pressure, leading to shock. Severe dengue is a medical emergency and needs immediate hospital care. Dengue doesn't spread from person to person. Instead, it spreads through the Aedes mosquito, which becomes infected after biting someone who already has the dengue virus in their blood. After a few days, that mosquito can now pass the virus on to the next person it bites. Aedes mosquitoes love to lay eggs in clean, stagnant water, like flower pots, open water tanks, buckets, discarded tires, pet water bowls, even bottle caps left outdoors. Their eggs can survive for months, even in dry conditions, and hatch when water is available. Dengue is diagnosed with blood tests that detect the virus or the body's antibodies against it. If you suspect dengue, especially with fever and pain, consult a doctor immediately. There's currently no specific antiviral treatment for dengue. Doctors focus on supportive care, such as keeping the patient well hydrated, monitoring blood pressure and platelet count, using paracetamol to reduce fever and pain. Avoid taking ibuprofen, aspirin, or other NSAIDs. They can make bleeding worse by thinning your blood. Most people recover with proper rest and care at home, but severe cases require hospitalization. The best way to stop dengue is to stop the mosquito. Here's how you can protect yourself and your family. Use mosquito repellents, especially during the day. Wear full-sleeve clothing and long pants. Sleep under mosquito nets, especially during the day if resting. Remove stagnant water from around the house, at least once a week. Keep water tanks tightly covered. Use window screens or mosquito-killing sprays indoors. Participate in community cleanup drives because mosquito control is a group effort. If you or someone in your home develops a sudden high fever, don't delay. Get tested, stay hydrated, avoid self-medication, and most importantly, take action to eliminate mosquito breeding sites in and around your home. Remember, one mosquito can lead to dozens of infections. Let's stay alert, stay safe, and fight dengue together. Thanks for watching. Like, share, and subscribe for more medical explainers.